How does palindromic rheumatism differ from RA? Imagine experiencing sudden bursts of joint pain that come and go, leaving no trace once they disappear. That's what happens with palindromic rheumatism. It is characterized by quick, recurring episodes of joint swelling, stiffness, and tenderness. These attacks usually last from a few hours to a few days and then completely resolve with no lingering symptoms in between. The joints affected can change from one attack to the next, sometimes involving just one joint, other times several. Importantly, these episodes do not typically cause permanent damage to the joints. Imaging tests like X-rays usually show no signs of erosion or structural damage, which makes this condition quite different from other joint diseases. Now, contrast that with rheumatoid arthritis, which is a long-term autoimmune disease. People with rheumatoid arthritis often experience ongoing joint pain, swelling, and stiffness that persist even between flare-ups. Unlike palindromic rheumatism, the symptoms tend to be more constant and can affect the same joints on both sides of the body, such as both wrists or both knees. Over time, if rheumatoid arthritis is not properly managed, it can cause serious joint damage, deformity, and loss of function. Imaging scans often reveal joint erosion and structural changes, showing the lasting impact of the disease. Another key difference lies in the pattern of inflammation. In palindromic rheumatism, inflammation tends to be periarticular, meaning it affects the tissues surrounding the joint. In rheumatoid arthritis, the inflammation is intra-articular, occurring within the joint itself. Blood tests can show elevated markers of inflammation in both conditions, but rheumatoid arthritis is more often associated with specific autoantibodies like rheumatoid factor and anti-CCP antibodies, which help in diagnosis. While some people with palindromic rheumatism may eventually develop rheumatoid arthritis, it is not a certainty. Palindromic rheumatism might be a precursor, but it can also remain as a separate, distinct condition. Diagnosing palindromic rheumatism mainly relies on clinical symptoms and ruling out other causes of joint attacks, as there is no specific test for it. Rheumatoid arthritis diagnosis involves a combination of symptoms, physical exams, blood tests, and imaging studies. In summary, palindromic rheumatism is episodic, with attacks that resolve completely and do not usually cause lasting joint damage. Rheumatoid arthritis is a chronic, persistent condition that can lead to joint destruction if untreated, both requiring careful medical evaluation to ensure accurate diagnosis and appropriate treatment. If you experience joint symptoms, it's always best to consult a healthcare professional for personalized advice and management.